So I really enjoy Paul Combs. I enjoy his drawings. And really, this was me in that time. That weight, if you can't see it, it says pride. So drowning in pride with all these sharks swimming around. Can anybody here relate to that guy? No, you guys are good. Why am I here? These people are good. But what about this one for the fire service or for any service? You know, we're trying really hard to make this net to catch our brothers and sisters. But this is truly where we are. But I will say this, we tend to look at it like it's an us problem, us versus them, meaning first responders versus civilians. But really and truly, this is not just a problem with first responders. This is a problem with the entire population. Did you guys know that suicide rates are up 34% in the United States since 1999? But what's interesting is worldwide, they're down 26% since 2000. So worldwide suicide rates are dropping, but in the United States, they're up 34%. I don't know why. I don't know why, and I don't know that anybody does know why. So one of the people that I look up to and respect the most in this field is Chief Dan DeGrice. He's with the Chicago Fire Department. They had a period where they lost several firefighters in 18 months. I think it was 7 firefighters that they lost in 18 months. And when that happened, he was like, we have to do something. So he jumped on board with trying to research, trying to figure it out, and trying to find solutions. And as he was doing all of his research and doing all of his work, the conclusion that he drew was basically this, that suicide is just one outcome of serious internal struggles for an individual that can manifest for some time before they make the decision to die by suicide. And if you can understand that, you can understand that suicide is just one outcome, meaning there are several other solutions. But you have to understand the part of serious internal struggles for an individual that can manifest for some time. So with that, suicide isn't just because of one thing, ever. It's not because of a divorce that just happened. It's not because I lost my job. It's not because Tim was bullying me. It is because of a convergence of factors, and most of them have to do with early lifehood adversity. I'm still at the point where I will not admit any early lifehood adversity, but the way I was raised, my mom and dad both immigrated here from Palestine, and they have a very traditional Muslim background. So it was always Muslim girls don't do this, they don't do that. And I was a tomboy, so I was embarrassing the family a lot. So there were a lot of times I got those looks like, oh, what's wrong with you? Why can't you do this? And now as I'm understanding things, and especially understanding the role of early lifehood adversity, I'm recognizing that me as a person, I react more to signals of failure. When somebody looks disappointed at me or when somebody's upset, I react more. And that's just the way it is, and that's how early lifehood adversity works. What we found is in protective services roles, police, fire, the military, people who were abused as children are more likely to enter into these roles because they're more likely to take control over their lives. So we can't ignore early lifehood adversity, just to throw that out there and make sure that we're all aware of that. So I did hit on this statistic that a fire department was 3 times more likely to die by suicide. But let me ask you guys this. Does anybody know what the suicide rate in the United States is right now? It's 14 per 100,000. That's the suicide rate. It's the 10th leading cause of death. And even 14 per 100,000, if you divide it in your calculator, it's like less than 0.001%. So very low likelihood. Does anybody know what the line of duty death rate for all populations is right now? It's 3.5 per 100,000. Are firefighters higher or lower? You say higher?
The line of duty death. Then the suicides are currently lower in the line of duty than they are suicide.
Us versus the general population.
Line of duty, us versus them is higher.
Lower. So our line of duty death is 2.5 per 100,000. It's lower than the 3.5 national average. I don't know what police are. The Bureau of Labor and Statistics has that data. You might be able to Google it and find out. But I think police are also lower, but I can't promise that. We know the pizza delivery guy is statistically more likely to die in the line of duty than we are. The garbage man, his is 30 per 100,000. His or her, sorry. In logging, I mean, they're way up there, construction. So our line of duty death rate is pretty low. And overall it is. It's 3.5 per 100,000 compared to the suicide rate of 14 per 100,000. So when you know those two pieces of data, is this number terribly alarming? It should make sense that suicide rates exceed line of duty rates. Does that make it matter less? No, there's something going on, and it's not just us. It's something going on nationally. It's something going on with all populations. And I'm proud of us. I think that in public safety, because we initially got off on the we're the victim mentality, we got involved with finding solutions before most people did. That's me. That's just my thought. That's an opinion. Most of this that I showed today and talk about today is not my opinion. It's research founded. So when I first got involved in my research, the first thing I did was go to Google. And man, I was just blown away by what I found and how many firefighters were dying by suicide. And if you look at this slide is of firefighters. I'm sorry, police officers. I will do better next time. These are firefighters who died by suicide. And if you look at this, what you should see, at least what I saw, was it doesn't discriminate. Black, white, young, old, male, female. It's affecting all populations. Has anybody ever been to any of the Out of the Darkness walks that the American Foundation for Suicide Prevention does? Have you been to that tent with the pictures? What did you notice from that? Pretty diverse. So you weren't seeing all like young people, or it's impacting us all. It's affecting us all, and that's one of the biggest things that I took away from is we're all at risk. And so this matters to all of us. And of course, that's why you guys are all here, because it obviously matters to you on a Friday that it's relatively nice. I think there's going to be storms coming. That's what I heard. So really and truly, why does it matter to me? And I think this picture says it all. So this is firefighter Jeremy Wall. He's a firefighter at the Cranston, Rhode Island Fire Department. He died by suicide February 19th of this year. And that's what he left behind. Wife and 3 children. But what's worse, his wife was pregnant. And I think the overriding thought is, how could he do that to them, right? How could he do that to him? And maybe even anger towards him for doing that to him. But my view and the approach that I take isn't why or how could he do that to him, but it's more of trying to understand what he was going through that made him choose suicide over his family and over asking for help. And the only way that we're going to make a difference, and the only way that we're going to start to prevent suicide, is if we can look at things from an understanding, an attempt to understand that person, where they were, where their mind was when they made that decision. And by doing that, that's how we honor them. That's how we honor future people thinking about dying by suicide. And hopefully that's how we honor his family. Because I think over anything, his family wants us to figure out what made him do this. And prevent others from doing it. And his wife did give permission to share this photo and to share him and his legacy. From what I understand, just a great person, great husband. I don't know much about the backstory yet because it's so fresh and so new, but it definitely was very devastating for his department and for his family. So in a nutshell, like one of the reasons that for us in public safety, suicide becomes an issue is because of the things that we value, right? Up here, these are all the things we value. These are the things that make you great at being a police officer, a firefighter, anybody in public safety. Strength, resilience, courage, adversity. If you can handle those things, you're great. The opposite of those things, the things that we fear, the things that we criticize, is the stigma attached to illness, mental health, not being perfect, right? Not being the helper. So in the research, this one quote, it just really resonated with me, and I love to include it in everything that I do because this is the one that really got to the heart of me, and it made sense. And it just simply feeling that we can't show any sort of vulnerability, that's what starts to isolate and alienate us. That's what was doing it to me. When I realized that I wasn't perfect, that I wasn't the best, and then especially as I started to think about suicide, as I felt depressed, I really became alienated and ashamed and scared to death that somebody would notice. And what the research has found, that alienation and isolation, those are key contributors to suicide and suicidal intention. So we've got to find a way to make sure people aren't alienating and isolating themselves, or that we're not alienating and isolating people. I think we're all guilty of it. I think we've all done it to somebody at one point or another, myself included. So I'm going to talk about a few common myths, maybe dispel them, maybe not. So what about this one? Does anybody here feel that they can walk up to somebody and ask them directly, are you thinking about suicide? Raise your hand if you feel confident. You guys are awesome. And be honest, raise your hand if you don't know how, or you're afraid, or you think by asking this question you could damage a relationship. You guys are liars. Because that's what I thought. I think one of the things is like, stay out of people's personal. Don't get in their personal. I would have been scared to death to ask somebody, you're thinking about suicide, because number one, what kind of answer are they going to give me? Number two, I'm probably going to piss this person off if I ask them this. And number three, the overriding thought that people have is, including clinicians. How many are clinicians? Awesome. Very good. Including clinicians, they said until recently, even clinicians were afraid to ask because of the fear that you might implant the idea in somebody's or a vulnerable person's mind. If you ask, you might give them that option. But I also, one thing I left off in my bio, I also teach for the QPR Institute. Have any of you guys heard of them? QPR stands for Question, Persuade, Refer. They teach suicide awareness and prevention, a very simple course. It's a 1-hour course, and it's all about asking the question. Because in their research, one of the greatest things that they found, and has been found by all researchers in the suicide field, is one of the only interventions that we have available today is simply asking. That's it. There's our ability to predict suicide today, no better than chance, no better than a coin toss. It's no better than it was in 1960. The researchers are working really, really hard. They're pouring their heart and soul into it right now, trying to figure out what they call the ideation to action framework, but they don't have that answer yet. And it's not their fault, it's not our fault. Well, it is. In 2006, 90 times more funding was directed at AIDS research than suicide research. 90 times. Yet more people were dying by suicide. Then and today, more people die by suicide than both homicide and war combined worldwide. Suicide is a leading cause of death. It's a public health problem, but it was so stigmatized that we weren't even giving money to the research. So somebody getting their PhD or somebody doing research, if there's no funding, you're not going to do it. So the research falls way behind. But in around 2016, and even a little bit before, but especially in 2016, the CDC, put their foot down and said, look, people, we're going to look at, at-risk populations, protective populations, and that's why all of a sudden you're just seeing an abundance of research falling in. One of the things I just heard this week, and it was really great, by one of the leading researchers on suicide, is if you meet anybody who says that they're the expert and that they have the answers, they're full of crap. And I tell you guys that too, for anybody that's doing what I'm doing. If you go hear anybody speak on this in public safety and they stand before you and say that they have the answers and that they are the best and they're the subject matter expert, be very wary of them. I won't say that about myself, and I've put a lot of time and work in this, but I know that I'm missing a lot of links and whatnot. But it's such a fresh field. Every day, new information's coming out, and we're understanding more. But again, the sad and unfortunate thing is our ability to predict it, no better than it was. So focusing efforts on prediction and identification and looking at-risk individuals is not going to do you much good. In fact, this is the scary thing. They found that 96% of people that were classified as high risk for suicide were false positive. 96% of people that are high risk, false positive. 50% of people who die by suicide would have been classified as low risk. So if you understand what I'm saying there, I hope you will understand that focusing everything on at risk and looking for people, you're going to be finding more people that are false positive. Here's an example. Have you guys seen the American Association of Suicidology, their mnemonic, is path warm? It's like a mnemonic on, looking for signs and symptoms, ideation, all this stuff. Well, one of them is anger. Anger is a commonly found risk factor for suicide. Do you guys agree? Have you heard that one? Let me ask you this. How many people know angry people who are not depressed or suicidal? There are a lot of angry people in the world. There are a lot of angry people, and most never ever even think about suicide. And that's how I love all the people hugging each other right now. That's how most risk factors for suicide work. Most people with a documented risk factor are not at risk. And most people who die by suicide did not and do not have the documented risk factor. Like previous suicide attempt, that's listed as one of the most predictive risk factors because I think it's 50% of people who died by suicide made a previous attempt. However, of all the people who attempt suicide, less than 7% will die by suicide. So even the greatest risk factor, very few percentage of people will follow through. Does that make sense? So what I take away from that, and this is where I think the research is going, but this is where I've kind of not been in line with most people, is screw risk factors. Screw looking for people. How about we change our culture to where people can ask for help when they need it? Because me, when I was depressed, when I was thinking about suicide, I made a point to make sure that nobody knew it and that nobody could detect anything. But in that period, I so desperately wanted somebody that I could talk to, wanted somebody that I could open up to. I was like making eye contact with people and like, would that person understand me? Would she have compassion? But I was scared, I never did. I thought about calling the Suicide Prevention Lifeline a few times at night when things just got really bad, and I was scared because I thought that the way it works is that they call the police and the police come to you. So I never called. I never asked for help. And now I know that if I would have, that would have been the first step to understanding what was wrong and finding solutions. And that's why asking about suicide is one of the greatest interventions that we can do. Just by asking somebody, hey, I've seen this, you've said this, I'm really worried about you. Are you thinking about suicide? For everybody I've talked to who's thought about suicide, they said that when somebody asked this, or if somebody did ask this, it was a huge relief. It was a huge weight that came off their shoulders because finally they didn't have to wear that big mask. That mask gets heavy. And I think most people who are public safety can relate to wearing a mask at some point in your career. And it gets heavy pretending to be what you're not all the time. So asking about suicide is one of the only interventions that we know of today that makes a difference. What about this? How many people believe that suicide's impulsive?
In young people sometimes, teenagers.
Sometimes, yeah. And I don't study the young people too often, so, but I do know, yeah, with teenagers, one of the reasons that they've become such an at-risk population is they're not sleeping like they used to. Kids need like 12 hours of sleep. They need lots of sleep. But now they have those iPads that they stay up on till 1 in the morning. And then, when I was a kid, video games I played were like Pong, or Zelda. Like there was very little violence that I witnessed in the games. But today, my nephews tricked me. They got me to buy them GTA 5. They didn't tell me what it was, and then I got it for them, and there's a lot of murdering in that one. So the kids, they are witnessing violence right up close, and they are perpetrating violence. So and we'll talk about them later, but two protective factors are being eroded from our children. They're getting more habituated to pain and violence and sleep. Their minds aren't getting the development that's needed. So that's why for kids, they do become at risk and they do make those bad decisions. But and I'll tell you this too, something I found, and it's not a bad thing. At first I thought it was a bad thing. I would read 2 articles by 2 researchers that I highly respected, and they would conflict. Like right now, Dr. Thomas Joyner, he is, to me, just the greatest suicide researcher out there. But people are publishing research to argue like what he says. And at first it was pissing me off. I'm like, don't go against him. He's the man. Like, why are you attacking him? But what I realized is it's good because you're challenging thoughts and looking for better solutions. So it's not a bad thing. So that's one great thing that I found is you'll read 9 articles that say suicide is not impulsive, and then you'll read 1 article that gives you evidence that it is. For everything that I found, you're seeing that. Like one of the statistics that's out there that I believe is 90% of people who die by suicide had a diagnosable mental health disorder at the time of their death. And that's repeated over and over and over again. But now there's a few people coming out there and saying, no, that's not true. So just to throw that out there, you will see conflicting information out there. And the suicide is impulsive. I did read an article that said it was, but from what I understand and everything that I've researched and learned, it's no way that suicide is impulsive. Suicide takes a lot of being beat down, a lot of depression, a lot of hopelessness to get to a point where that's your only option. But even when you get to that point, you have to have the capability to enact suicide, to be able to complete suicide. What is our strongest instinct? The survival instinct. We all work in public safety. We've all gone to people, whether on hospice, whether injured themselves. And what does the body do, generally? It fights, right? The body will fight to stay alive. The body does some crazy things. You ingest some bad stuff, what happens? Yeah. You get cut, what happens? It clots. The body fights it. So dying by suicide is really hard. And then on top of that, we have this thing in our brain called the amygdala. Anybody familiar with the amygdala? I have to always ask that because I didn't know what it was until I researched it, so I'll explain it a little bit. The amygdala is, for firefighters, it's like a smoke detector. It is what receives information first. And it decides, is this information for our survival or not? And if it decides that this information that it's receiving could put us at risk, it puts the body in fight or flight. When the body goes into fight or flight, guess what happens? What happens to the thought process? It diminishes. I saw this week and it was so cool. So our brain is formed from the bottom up. So it starts at the brainstem. Your reptilian brain is the first part of the brain that's formed. It's while it's in the womb. And the reptilian brain does what reptiles do. It's a pretty lazy part, but cry, sleep, eat, feel warm, but no real thinking. If you look at reptiles, when they're in a cage, they just go sleep in a corner. Not much there. Then from the day that you're born to the day that you turn 2, the limbic system forms. And that's what they call the mammalian brain. So it's what mammals do. They don't really do a lot of thinking. They don't speak. They don't rationalize. But they know how to protect themselves, right? And it's shaped on experience. It's shaped on the way that you're raised. So in the first 2 years of life, the way that you're raised, the way that you're loved really shapes that limbic system. And that limbic system is responsible for all of fight or flight. Autonomically, without your thought, it either fights, runs, or just shuts down into the reptilian brain. But then after you turn 2, the prefrontal cortex develops. That's this part. The prefrontal cortex is where you make rational thoughts. All emotions live right here in the limbic system. Rational thoughts live here. So my thumb is the amygdala. When sensory receives information, the first place it goes is to that amygdala. The prefrontal cortex doesn't get it if the amygdala decides that it's dangerous. So that's why you hear people say they blew their lid, because literally the prefrontal cortex turns off, you can blow it. And everything goes to the emotional brain. And the emotional brain makes all those decisions. So when you're under stress, when you have that tunnel vision, you're thinking about killing yourself, even if you try, more than likely the amygdala is going to protect you. It's going to turn off your prefrontal cortex, and it's going to stop you, so you're not going to be able to think yourself through it. So dying by suicide is extremely difficult. So to think that it's impulsive, or even to think that it's the easy way out, is further from the truth. It takes a lot of work to get to the point to make that decision and complete it. For me as a mountain biker, I see it like yesterday. I'm sitting here riding that gauntlet, and I'm like, I'm going to make that jump. I'm cool. And you get to it, and what do? Yeah, stopped. And that's how the amygdala works. It works. It takes really good care of you and protecting you, but sometimes it turns off all of your rational thought. That's why police officers, you guys are trained over and over to shoot the exact same way, because when you're in that battle, you're not going to make a real rational thought. You're going to do exactly what you're trained, right? And the same for us in firefighting. We should be just doing the basics over and over and over again, because when we get into a fearful situation, we're not going to think up a great solution. We're going to do what we're taught. What about this one? You must be out of your mind to complete suicide.
Based on what you just said, you have to have absolute conscience of what you're doing.
Thank you. Yeah, that was well said. You do have to have absolute conscience. And I've heard people say, like, man, alcohol played a role. Alcohol played a role. Believe it or not, they found very little alcohol in people who died by suicide. Multiple studies found a third of people who died by suicide had alcohol in their system, and it was below the legal limit. And if you understand what I just said, it makes sense that you can't be impaired in any way to get this thing done. You might want to take the edge off and be drunk, but you won't be successful. So to think that somebody has to be psychotic or delusional to die by suicide is just not true. Lots of very sane, rational people complete suicide, and they complete it as a rational decision. Why we could get to the point where we think about it, we're all fixers, right? Day to day, we fix things. Imagine being hopeless and not seeing anything getting better. What is the ultimate fixing? Yeah, I mean, it's so sad, but it's true. It's the ultimate solution, albeit not the right solution, but it is the ultimate solution. So one of the best ways to understand this for me is, unless you've ever been to the point where you have thought about suicide, it's really hard to understand how somebody can get to that point, because it takes a lot of pain to get to that point. So fortunately, most of us haven't been to that point. But unfortunately, a lot of us have. But until you've been to that point, it's really hard to understand how somebody can get to that point. But it is an extremely unfortunate, rational decision. And I did say, and it is true, nearly 100% of people who died by suicide did have a diagnosable mental health disorder at the time of their death. It was diagnosable, it was trackable, meaning we could see it, it was treatable, and it was nothing to be ashamed about. But we live in this world right now where we're very fearful of mental health disorders. Anybody have any idea what lifetime rates of mental health disorders are for all people? 50%. 50% of people will meet diagnostic criteria for a mental health disorder. That doesn't include subclinical diagnosis. And I think back when I was going through what I was going through, I definitely would have either been diagnosed major depressive disorder or subclinical. So mental health disorders are extremely common. I mean, just draw this line and all of us are going to meet criteria on this side of the room. Congratulations, you guys are protected.
Well, what makes you think, when you say that, what makes you think that those people
Because I'm on this side.
are the ones with the disorder?
Because I'm on this side.
Okay, because maybe all these people that don't meet that clinical criteria are the ones with the disorder. It's all on how you define normal.
You're right. You're absolutely correct. And of the 90% of people who died by suicide, 60% it was depression. And how many people here have felt depressed at some point in their life? And during that time, how many people felt hopeless and that it would never change? Yeah. And then this last one, suicide is selfish. It's hard to talk people out of that one. But I hope with the next few slides that I can at least change it a little bit. Because yeah, when you look at Jeremy Wall and you look at what he left behind, it looks absolutely selfish that he ended his pain and just transferred it to all of those people. But sadly and unfortunately, the overriding thought in somebody's head who dies by suicide is that they are a burden and that their death will be of service to everybody around them. And that's the saddest part of it all. So I'm going to talk briefly about Dr. Joyner's theory. It's one of my favorite theories, and then we'll take a break. It's such a simple theory. From what I know, us in public safety, we like the rule of threes. This falls into it because it's only 3 variables. So what Dr. Joyner says is you have to have these 3 at once in order to complete suicide. And this theory was created in 2005. It was put out there, and multiple people have tried to disprove it, have tested it, and it's still a valid theory, which if you are involved in science and research, you know that a theory that lasts this long, it means there's something to it. The bad thing about this theory is it does not explain ideation to action. It explains how somebody could die by suicide. It can explain how somebody would die by suicide, but it doesn't explain how they go from thinking about it to doing it, and that's the hard part. So what he says is you have to have perceived burdensomeness, and the word perceived is always there because it's that person's misperception. It's not a fact. It's how they feel themselves. You have to feel like a burden, that you're not contributing to society, and then you also have to feel like you don't belong. He uses the word thwarted belongingness. I didn't really understand what that word meant, so I took it out. But my understanding of it is thwarted is you're pushed away. You're pushed out of that belongingness. It's not just that you don't belong, it's that you're rejected. So when I ran across this, for me, things made sense. You know, when I was depressed, one of the worst parts was I felt unworthy to mention it or ask for help, because I was like, man, people have had major losses, you know, people have seen really bad things, and I'm sad because somebody's being mean to me. Like, I felt so unworthy and so silly that I kept it to myself. But then when I got here, it made sense. I had thwarted belongingness. I did not fit in my firehouse. Perceived burdensomeness. I just got promoted, but they didn't respect me in that position, so I felt useless, and I felt no change in that. So when you feel like you don't belong and you feel like you're not contributing, when those two come together and they last long enough and you don't see any way out, that's what leads to hopelessness. That's what leads to a desire for death, is that hopelessness. Fortunately, without the third variable, the capability, you're unable to enact suicide. So you have to have that third variable, and I'm going to talk about each one of these in its own slide. That third variable, none of us are born with, because to get to that third variable, you have to overcome the survival instinct. That's how you get to that third variable. So the first one, perceived burdensomeness. It's simply the view that your existence is a burden to others. It turns to self-hate. The scary part is this one. It's flawed and defective, meaning nobody can understand me because I'm not designed like anybody else. And that's what makes it hard for people who feel this way to talk to other people about it, because they don't think anybody can relate. And it's really scary to open yourself up to people when you feel crazy and that they can't relate to you. But in an essence, it's the view that your death could possibly be worth more than others than your life. Dr. Joyner did 2 studies of suicide notes. He compared the notes of people who attempted suicide and died, and then he compared the notes of people who attempted suicide and didn't die. What he found, the difference between those notes was the people who actually died by suicide had more expressions of burdensomeness in their notes. So the overriding theme was burdensomeness. And that's over and over and over again what they're finding is people who die by suicide, their overriding thought process is their life is damage to others. And by dying, they'll do others good. Just like the insect population, if you study insects, they will kill themselves to protect others. That's why like some of those ants come to the top of the ant mound and let you stomp them out. They're protecting like the queen ant down there. And over again, there's studies of insects. So the view of burdensomeness is across all the animal kingdom that they found. So the second variable is that low belongingness, that thwarted belongingness. It's just a simple experience that you're alienated, that you're not an integral part. And no matter how much social media makes us feel like we are connected and we disconnect from the world, we are pack animals. We have to be connected, and not on Facebook. We have to actually be connected with people. It's integral in our lives. You know, we're mammals, like no question about it. We are mammals. And think about any animal species, lions, all that. In the wild, when one gets left behind, what happens to that one that gets left behind? It ends up dying.
One way or another, either it's killed or it starves to death.
Yeah. No animal survives on its own. It's impossible. It's impossible to survive on your own. We are hardwired for connection. It's inherent and it's necessary. It is the strongest predictor of suicide. It's the view that nobody cares. Clinicians, when they're doing a risk assessment for suicide, one of the questions is there anybody that you can call? Is there anybody that when you feel this way you could reach out to? If the answer is no, nobody cares, that's high alert. Like, oh my goodness, I have to watch out for this person. So interesting thing, they found reduction in suicide in times of unity. So anybody here remember the Miracle on Ice? It was in 1980. A lot of you weren't born. Were you born? No. You watched it. So what was going on in the United States during 1980 and in the world?
Cold War, Afghanistan invasion by Russia.
Yeah, the Russians had invaded Afghanistan. There were hostages in Iran. The Cold War, we were building bunkers under our houses to protect ourselves. Things were pretty intense. It kind of reminds me of the Canes that won the other night. Sorry, when I was in Henrico yesterday, there were some big Capitals fans, and I was so happy that we won. But so our amateur team, because the U.S. hockey team, we couldn't have any of our great players, so we had to have just our college kids. They played the Russians, who were like full of professionals because they didn't follow the rules, and we kicked their butts, kind of. We won. We pulled off the win. And it brought a lot of unity. It brought a lot of hope in the United States. A lot of people got hope out of that. And what they found was right after the Miracle on Ice, suicide rates dropped. And so Dr. Joyner was like, let me see if this, if this is a common theme. So after President Kennedy's assassination, they found in 29 states there were no suicides for 6 days. This was before the CDC had data on all states. That's why they don't have all states. But in 29 states, suicide rates completely dropped after Kennedy's assassination. So coming together, there's something to it. A time I think we all know, 9/11. We all understand how we felt, what was happening then. In 2000, on average, every day, 90 people were dying by suicide. The peak was always Monday and Tuesday. That's how it is. The suicide peak's always Monday and Tuesday. It's kind of like if you work EMS, which you guys do. We're lucky. We have a separate crew that do that. On Mondays, everybody calls for the ambulance, right? They build up and wait till Monday to do it. The same thing with suicides. You have to build up to it, and that's why Mondays is usually the peak. So on the Sunday before 9/11, it was 93 suicides, about on par. On Monday, it was 98. On Tuesday, 36. It was the lowest recorded number of suicides in the history of the United States on 9/11. So taking those three together, it tells me two things: that coming together can be life-sustaining. Having a purpose, a cause greater than yourself is life-sustaining, yeah? Something else it tells me, now that we understand that suicide isn't impulsive, is that something can happen to change somebody's trajectory. Something can happen to change their mind, because you hear a lot of, if they're going to do it, they're going to do it, there's nothing we can do. I hear that a lot. And I even have been criticized for calling myself understanding and preventing suicide, because people say that you can't prevent suicides, and that by telling families that you could, you might actually be harming them by saying that. And you're right, we can't prevent all suicides, but we can prevent some, and that's the goal. So the last variable, what were the first two? Awesome. Low belongingness and perceived burdensomeness. I reiterate that because going forward, if you recognize somebody's isolated or they don't belong, and they make comments that they're a burden, or they make comments that they don't do anything, those are things to kind of clue in, like, hey, let me check on this person, let me talk to this person, let me bring this person in, let me make this person feel like they have worth. The last variable is the static variable. So the first two are dynamic, meaning those can change. You can have them and they don't have to stay forever. This third variable, it's static, it doesn't change. Once you acquire the ability, once you get over the instinct to survive, that's unchanging. That's why they say for us, it can be dangerous, because in our jobs, we are exposed to painful and fearsome events, so we can acquire the ability before most other people can. So really and truly, it is just higher pain tolerance. To overcome your instinct, to develop that pain tolerance, it requires habituation towards painful and fearsome events. So combat veterans, they're people that are most at risk. Somebody who has nearly died, somebody who's felt extreme pain, terrible car accident, broken bones, somebody who's hiking in the mountains, seriously injured and has to walk 7 miles. Those people have overcome it a little quicker than most of us. Just being a first responder doesn't get you there, because we all know that there's somehow people that slip through the cracks. So we're not all superhuman. And some of us spend a lot of time in our career without experiencing a near-death experience. Some of us make a whole career without it. So just being a first responder doesn't give you this. It's that experience, that fearsome experience, that overcoming pain to get to where you're going that can get you here. So I just bring this picture up again just to put it together. Any questions on Dr. Joyner's theory? Does it make sense? Awesome. So let's take a quick break, if y'all don't mind. There's so much stuff to talk about today.